Hi, welcome to another discussion and talk that I like to do from time to time. Today I thought I would just bring in the very common scenario for us as therapists when people come in with, they talk about, maybe they've been to their GP and they've come in with Piriformis Syndrome or Sciatica. I've got that pain, aching pain down the back of their legs. Maybe it gets worse if they sit. Maybe it gets worse if they drive or dig the garden or that kind of thing, and hot baths and things relieve it. Maybe an ice bath helps it. But so what are the differences between sciatic pain and Piriformis syndrome? The symptoms are very similar. What you're living with is very similar. So I thought I'd spend a bit of time just explaining the two, and then lead on to an evening we're going to do. So let's start with sciatica. Sciatica is an inflammation of the nerve endings along the lower back. So L4, 4, 5 there. It can be S1, 2. It can be right down to the nerves that come out of the lower back. Sometimes it's related to a particular incident, and I think always our work is about listening to the client and getting their story. How long have you had it? When did it start? Did you have a fall? Was it overuse? Do you do a lot of driving? Do you carry heavy weights? All that story is really relevant to sciatic pain. And is there an incident which occurred that from there on in you were getting this lower back pain that radiates through and comes down the back of the leg? Now, sciatic nerve, as it comes through, it comes out of the last four of the vertebrae in the lower back and then feeds through. And I've got a slide here, you can see comes behind the piriformis muscle, which I'll talk about in a minute, and this both is as thick as your little finger. It's a big nerve. From about the base of the glutes it divides and down the front and the back of the leg. So hence when this nerve is impinged, squeezed, either by a bulging disc or by tightness of the muscle through here, quite often it's more about a bulging disc that causes these issues on sciatic referring pain, and that radiates down the leg. Pins and needles, maybe if it's really bad, L4, L5, you're getting that kind of S1, you're getting that pathology in your foot, so maybe plantar is actually difficult to do, standing up on your tiptoes are bad, it gradiates through. I suppose the important thing about sciatica is that we're not trained to really analyse that. We can give the implication that there's an issue. So our first port of call is always back in through to the NHS. A scan may well be required to really tease out how much and where is that nerve being impinged, causing that range of movement. We can do some, and I think the key bit for me, I've seen many people with sciatic pain and sciatica in the lower back, and you're working with another health professional, particularly a really good physiotherapist, osteopath, that kind of stuff can really work in tandem, and we work alongside, we're good at that, and it really works well. So I'd like to now then move on to the kind of area around Piriformis syndrome, which does present in a similar kind of way in that you're getting that referring pain down the leg. It can be related to a sport or an action that you do on a regular basis. Driving is an obvious one, where that foot is on the accelerator pedal all the time if you're driving automatic. That often is, I've seen that many times. The sciatic nerve, the Piriformis syndrome, is where the nerve is actually getting pressed onto and by the piriformis. And there are lots of different types. There's 4 or 5 different types, where in some people there is actually a split and a gap in the piriformis where the nerve comes through. So every time you do that rotation and you're firing that muscle, it's a lateral rotator, it turns our leg outwards. Every time you do that move, or you stay in that position for any length of time, then the pressure is implied and pressed on that nerve, and yet getting all that leg pain and that radiating stuff all the way down the leg can be really debilitating and exhausting for people. It's a really unpleasant scenario. Piriformis syndrome is very much our bucket. We can do this. This is what we're trained to do. We're trained to find the piriformis in fine detail. We're trained to assess it and see how bad it is. And then, of course, we're trained to do our level 4 moves in terms of thinking about STR, soft tissue release, muscle energy technique. Really good techniques to start to lengthen these groups of muscles and unpack, take away the pressure that is leaning on that nerve, that sciatic nerve. We plan to do, on the 1st of August, we plan to do an evening, our Thursday evening range, as you know, that it's an ongoing programme for us, our Thursday evenings. And I wanted to do an evening where we case study sciatic pain and piriformis syndrome, really teasing out assessment, really important to work out, has this person got sciatica, and therefore bring in other health professionals, or is this, no, that isn't sciatic an issue, this is a piriformis issue, and therefore very much I like it, and I'll be showing on that evening the techniques to assess, and also the techniques to really work out and tease out the muscle groups in fine detail, and the treatment of that, and really open up working with the lateral rotators and making that happen. If you can do it, it's the 1st of August, it'll be lovely to have you there. I know it's busy, I know there's going to be limited seats, so if you're keen to do that, then book your place, and I look forward to seeing you. Thanks.